Hello and welcome. Today I'll be discussing about sweating and external colds. I am Yu-Chih Chen, a doctor of traditional Chinese medicine. Sweating is a natural process for the body to expel extra heat, where body temperature can be maintained with stability. It is also a mechanism that ensures healthy body metabolism and processing. The human body requires stability in temperature for it to function properly, and extra heat generated in the process of body mechanisms and metabolism needs to be expelled. This heat cannot be reused by the body and is required to leave the body as waste heat. The human skin is able to metabolize and expel heat, where waste heat inside the body can leave the body very efficiently. When body mechanisms are healthy, the skin would expel waste heat through the process of sweating, where other waste products are also metabolized and expelled. When this mechanism is obstructed, a person can easily feel hot with the waste heat trapped inside the body. When feeling hot, most people would use fans, air conditioning, dress less, enjoy cold or icy foods and drinks. However, when sensations of feeling hot originate from waste heat trapped inside the body, there is already obstruction in the sweating mechanism of skin function. Therefore, enjoying cooling winds, diet, and less stress would only accumulate external colds, causing more injury to skin function and further obstruct the body's sweating mechanism. External colds are external influences that affect the body, and is mostly presented as changes in temperature over the skin. For modern people, external colds often result from temperature differences in the environment or foods and drinks that enter the body at below body temperature. Accumulated external colds over the skin surface cause disruption in temperature sensations with regards to the environment, and the person would fail to register the body feeling cold in time, which also adds to the accumulation of external colds over the skin. Cold foods and drinks that cause temperature differences through the gastrointestinal tract would decrease activity and rate of metabolism of body cells and tissues through external cold. When this happens, these cells and tissues would rely on the unaffected and active cells and tissues to maintain expected body functions, forming compensative functioning. The scope and form of these compensations differ from person to person, but long-term compensations are guaranteed to influence and affect more body tissues and their function. This would cause general weakening of body functions and metabolism over time, which affect basic metabolism, immunity, and normal functioning of the body. As mentioned before, extra heat produced from body metabolism cannot be reused by the body and should be expelled by the sweating mechanism of the skin. When compensative functioning happens, more heat is produced from the extra work and metabolism inflicted upon body cells and tissues. This heat is different from the heat produced from expected body functions, but there are also waste heat that cannot be reused by the body, and they are called asthenic heat in terms of Chinese medicine. Asthenic heat generated by body compensations can effectively produce sensations of feeling hot. Asthenic heat require rest, water intake, and stable skin mechanisms for it to be expelled from the body. However, most people are unaware of their physical body going into compensation, and it is often that compensative body functions have already accumulated for a long time when people eventually sense certain discomfort. Compensative body mechanisms are easily formed and are very common problems for modern people. Lack of sleep, sleeping too late, cold foods and drinks, bakes, deep fries, spicy hot foods, and stimulating substances such as tea and coffee, or smoking, alcohol, diets rich in sugar, salt or oil, or simply fatigue are all causes and reasons for body compensation. Accumulated body compensation can be mild or serious, but they inevitably cause physical burdens and weakening over time. Asthenic heat requires sweating mechanisms from the skin to effectively leave the body. However, when there is external cold influencing the body and skin, there is often obstruction and interference on the sweating mechanism. External cold inside the body interfere with energetic flow of body organs and meridians while increasing the need for body compensations on a cellular level. External cold over the skin and body surface interfere with the acuity and accuracy of body sensations on environmental changes, as well as interfering with overall body functions and immunity. These factors that affect healthy and natural body sweating mechanisms allow the accumulation of asthenic heat, causing the body to direct itself into worsened compensation, as well as leading the person into the illusion of feeling hot. When the body cannot expel waste heat efficiently, a person is not likely to feel comfortable. Asthenic heat leads to emotional instability, lack of concentration, stress, fatigue, shallow sleep, difficulty sleeping, as well as all sorts of energetic and organic problems, such as bloating, tenderness, pain, cramps, spasms, or worsened presentations of illnesses and disease. However, a weakened body with accumulated asthenic heat can still sweat, even if it is not effective sweating that is meant to expel waste heat. This is considered as cold sweat, which is sweating without the proper function of excreting extra heat. A person can have difficulty sweating, is able to sweat, or sweats easily, but the level of sweating that can be observed by sight is not necessarily proportionate to the integrity and function of the skin sweating mechanisms. The conditions and ways a person sweats is also not necessarily proportionate to body conditions regarding the accumulation of external cold and asthenic heat. The dangers of asthenic heat is how it causes the person to believe in feeling hot. When a person cannot feel cold, he or she will not take precautions in keeping the body warm. The illusions of feeling hot from asthenic heat often mislead a person into allowing the body to be continuously exposed to external colds without awareness. The repetition of this vicious cycle continue with the accumulation of asthenic heat, causing the person to not willing to keep warm, causing the accumulation of more external colds where more asthenic heat build up inside the body. The person is likely to dress less, favor cold foods and drinks, wish for cooling air all the time, which further accumulate external colds. This builds up multi-layers of complexity inside the body, where cold and heat are intertwined with each other. These problems move onto deeper levels inside the body over time, and the resulting discomforts and illnesses are also more difficult to treat. Another danger of asthenic heat is how it creates the illusion of being energetic. Accumulated asthenic heat causes compensative overwork of body cells and tissues, which is sometimes referred to as inflammation in Chinese medicine. This is not inflammation defined by medical terms, where the aggregation of white blood cells and phagocytosis induce the formation of pus or bleeding. Inflammation related to asthenic heat is used to describe excessive heat which cause unstable conditions that can transform into worsened conditions related to symptoms associated with inflammation, such as acne, pain, oral ulcers, or swollen and painful gums. Besides these unstable or inflammatory conditions, asthenic heat can also misguide the person into believing that they are in good spirit, where they are unaware that they are actually in need of rest, sleep, and fluid intake, or that they should avoid stimulating diet. This kind of illusion often results in continued accumulation of asthenic heat and compensative body mechanisms, causing further injuries to body functions over time. When compensation of body functions and asthenic heat continue, people may sense general discomfort, but most do not seek medical attention because they do not experience severe symptoms or illness. However, when the body continues to compensate, reaching a stage where it can no longer provide sufficient compensation, it can also fail to present asthenic heat, showing a person with general weakness who is also susceptible to lower temperatures and feels cold easily. Before reaching the stage, asthenic heat and body compensations can usually continue for quite a while. Therefore, when a body actually enters such a stage, it has usually depleted most of its compensative mechanisms in maintaining body functions, and it is also often that treatment requires a lot of patience and time. Treating and tuning a body at this stage require detection and balancing of the intertwining problems at different layers of body energies. In the process of treatment, patients can experience discomfort when body functions and mechanisms gradually become revitalized. I often remind and encourage them to be self-observant and patient with their physical improvements. As mentioned before, the expulsion of asthenic heat requires healthy skin mechanisms where effective sweating is important. When there is external cold affecting the body surface, this mechanism cannot stay unaffected. Even so, having the ability to sweat is still better than the inability to sweat. However, it is still important to remember that the visible condition of sweating is not necessarily proportionate to the skin having appropriate function in metabolizing and expelling asthenic heat. Cold sweats are sweating without the ability to metabolize or expel asthenic heat, and is a condition that also requires time for treatment. Both external colds and asthenic heat can induce accumulative body compensations which disrupt the autonomic nervous system and can cause autonomic disorders over time. Therefore, external colds, asthenic heat, and body compensations not only induce misguided illusions on sensation, but also disrupt the autonomic system, causing various degrees and presentations of dysautonomia. For Chinese medical treatments, asthenic heat and external colds are important factors that require close observation and evaluation. However, external colds and asthenic heat are problems that are often incorporated within different kinds of chief complaints, ranging from headaches, nasal allergies, sleeping problems, common cold, aches and sores, pain, urinary complaints, gynecological problems, and reproductive issues. Energetic mechanisms involving organic functions and meridians can also be affected by external colds and asthenic heat. Therefore, when it comes to treatment, pulse diagnosis or physical examination of muscular and fascial tension, external colds and asthenic heat are always considered. When practicing acupuncture or herbal prescriptions, one should also understand and be aware of the energetic levels of treatment and properly triage the problems associated with these energy levels. The human body is a very intricate and complex system that involves not only the physical organs, functions, meridians, and pulse presentation, but also how personal lifestyle, diet, habits, thoughts, and emotions affect and influence various body mechanisms. Therefore, when treating a singular clinical problem, there can be a wide range of energetic levels and considerations that needs to be maintained and stabilized in the process. As mentioned earlier, when a person eventually decides to seek medical attention, it is often when accumulated discomfort and problems have evolved over time, until it feels serious enough for the person to sense the need for medical attention. This also presents the greatest challenge in clinical work, since medical knowledge and insight is the most time and energy consuming part of communication, yet also the most important and valuable part of medical professionalism. It is only when people are willing to understand and accept their personal way of taking care of their body and is willing to attempt change with increasing awareness that personal responsibility and healthcare can truly be implemented, and clinical relationship between physician and patient can truly be of meaning. Other than the communication of basic concept and healthcare, treatment with Chinese medicine often involve accumulative and intertwining problems, since Chinese medicine considers the human body as a holistic and interconnected system in dynamic equilibrium. Therefore, treatment can involve herbal prescriptions, acupuncture, or muscular and fascial manipulation techniques. But the consideration of energetic layering, athenic heat, and external codes needs to be triaged with each visit. Accumulated problems and energetic injuries are intertwined similarly to a ball of entangled yarn, which cannot be resolved by forceful pull or slicing. Body energies need to be stabilized to relieve local tension and restore basic nervous conduction before organic functions and meridians can be replenished, where overall energetic flow and body mechanisms can rebuild with better balance. Energetic balancing and maintenance is important with Chinese medicine because it allows the body to naturally maintain energetic reserve, which will help the body manage and maintain its foundations when facing external stimuli, stress, or pathogens that can cause illness. For basic maintenance and self-care on external codes and healthy skin mechanisms, the article on sweating exercise is very useful. It is a simple exercise that can be done at home. The link for the article is in the description below the video. The accumulation of athenic heat and external codes result in various degrees of autonomic disruption, body compensations, and energetic disturbances within cells and tissues. Cellular and tissue energy imbalance result in tension, spasms, and further loss of expected function, where more complex problems such as disrupted neurotransmissions, feedback, and functional disturbances arise. These problems often span over multiple energy levels with complex connections, and treatment require gradual and ordered relief of these interconnections so that blood circulation, oxygenation, and neuroconduction can restore balance, where body cells and tissues can regain vitality and proper function. The reason for emphasis on body energy levels and treatment stability is the energetic compartmentalization of physical problems induced by the body. It is a protective mechanism where the body would choose to segmentate energetic emphasis of one single tissue, such as an organ or a muscle, so that the level and degree of compensative mechanisms can be contained. These compartments need to be detected and triaged through pulse diagnosis so that treatment methods can take them into consideration. Without awareness of these energetic differences, treatment would require reserve energy from the body to initiate linkage and maintenance of these energetic differences, which may not be successful. When the tissue is required to perform function without balanced energetic distribution, with or without medical intervention, the body would compartmentalize and compensate even more, further burying the problems until a time when the body has enough energy to present them, which is the optimal process. However, what actually happens for most people is that the body becomes so depleted of its energetic reserve that it is unable to even maintain compartmentalization, causing problems to show very suddenly with rather serious presentations, which also present clinical difficulty and challenge. Therefore, in the process of diagnosis and treatment, I place a lot of emphasis on communication and maintenance of body conditions and stability, where energetic flow can be established between segmented parts and levels. It is through this that blood circulation, cellular oxygenation, and neuroconduction can be restored, helping the body to revitalize functions. This kind of stability is not necessarily proportionate to physical strength or weakness. Patients who are energetically insufficient can build their body functions and strength with enough stability, while patients with better energetic reserve can present symptoms or discomfort more strongly if treatment does not maintain stability. Therefore, whether or not the person is energetically sufficient or insufficient, body stability and functional equilibrium is still of most importance with Chinese medical treatments. Athenic heat, external colds, and cold sweats are often associated with modern obesity, since overall body metabolism can be impaired when body tissues cannot maintain proper function and balance, and basic metabolism rate and tissue function can also be weakened. This happens when there is not enough energetic reserve for the body to compensate or replenish itself in time, causing general weakness and loss of functional balance. Accumulated physical discomforts and emotional stress can cause gradual energetic depletion that require proper insight and understanding for improvement and maintenance. Common observations of accumulative depletion are general fatigue, tiring easily, shallow breathing, stress, and emotional or mental disturbances. The sweating exercise can help the body with skin metabolism, neural sensitivity, and autonomic stability. One should also avoid foods and drinks below body temperature, keep to whole foods without excessive condiments, avoid diets rich in oil, sugar, and salt, as well as bakes, deep fries, hot spices, and stimulating substances. Obesity associated with weaker body functions often appear bloated or puffy, or appear loose or swollen without obvious tissue injuries. External colds and athenic heat can influence body tissues and organ functions, causing neural, lymphatic, and soft tissue disruptions that can be worsened with external colds over the skin. The body can only strive at various compensative measures, trying to overcome these limitations and maintain basic function, forming the vicious cycle where body tissues present different degrees of tension, weakness, spasms, and flaccidity. This kind of obesity can also be treated and adjusted through traditional Chinese medicine. When the body is too weak, or when body functions are especially insufficient, only acupuncture and herbal prescriptions are advised. When the body has enough reserve energies, weight loss and body sculpting acupuncture and herbs may be used, placing emphasis on metabolism and local sculpting. Basic understanding and precautions with acupuncture also apply with weight loss acupuncture, which can be found in the article Acupuncture. The link for the article is also in the description below the video. For weight loss acupuncture, it is important to know that the needles used are thicker than standard acupuncture needles. Acupuncture needles are single needles, but weight loss acupuncture uses thin injection needles, where the lumen of the needle is used to place a segment of absorbable suture into desired acupoints. The absorbable suture here is the same kind of suture used in medical surgery. Weight loss acupuncture is often applied to areas with more abundant adipose tissue, such as the abdomen, under the upper arms, the lower buttocks, and inner thighs. Acupoints for weight loss acupuncture can also be selected to accommodate functional or organic improvements, so that prolonged emphasis can be achieved with body sculpting as well as energetic elevation. With weight loss acupuncture, local skin surface sterilization and post-treatment care need special attention, such as avoiding local application of body lotion or cream, and avoid soaking or bathing the skin in water. This is often avoided for 3 days. Local bruising can also appear, as it is with standard acupuncture, and bruising is often associated with the surfacing of deeper problems or connections in the body, since I don't deliberately stimulate or approach blood vessels through treatment. This kind of bruising should be allowed time for the body to metabolize and absorb, where energetic conditions can also be observed through the rate of absorption. However, if the physician chooses to exercise special manipulations through acupuncture, such as specific ways of stimulation by moving the needle, bruising caused by these manipulations will be different from my clinical approach. Weight loss acupuncture is often paired with herbal prescriptions as supplement for body metabolism and function, with additional emphasis on gastrointestinal functions, general energetic maintenance, and sleep quality. More information on herbal concept and prescriptions related to weight loss and body sculpting can be found in the video on diarrhea, soft stools. This is the discussion for today. Please like, subscribe, and turn on notifications. I will now move on to items for sale. This is the Spiritual Calm Incense Pouch. It contains 6 different kinds of incense. There is cypress, agarwood, sandalwood, incense cedar, wormwood, and Acronychia pedunculata. The incense is mixed and designed by myself. You can place it under the pillow, by the bedside, or place it in your bag. It needs to be kept dry. This is the Spiritual Calm Essential Oil Spray. It is a blend of 6 different essential oils mixed with alcohol. It has the lemon eucalyptus, true lavender, palmarosa, Atlantic cedar, rosewood, and frankincense essential oils. It is also designed and mixed by myself. It blends well, but you should still shake it before spraying. More instructions and recommendations are available in the article Spiritual Calm Essential Oil Spray. The link for the article is provided in the description below the video. This is the crystal stone pendant. There are 4 different kinds available. There is the amethyst, jade coral, tigrite, and obsidian. You can read about their descriptions in the article and choose one that suits you. The necklace should also be kept dry. Items for sale are handmade and designed by myself, purchased by meeting only. You can message through Facebook for purchases. There is more paid content on my Patreon page. There is the tarot interpretations based on personal energies with introduction and meanings of each card. There is also the chakra energy essential oils that show you how essential oil scents apply to chakra energies. I also have daily tarot readings on Twitter if you are interested. Now for the Q&A section. I was asked about how I would know which essential oils to recommend. The essential oils are the seasonal essential oils for chakra energies. There are videos on them for spring, summer, autumn, and winter. The videos contain the recommended essential oils, but actual prescription and specific amounts is on Patreon as paid content. I select the essential oils according to how the energies of the atmosphere interact and connect with the human body. The essential oils are chosen by the properties through their scents, which can help the body with energetic elevation or adjustments in relation to seasonal changes. The detection of these connections can be realized through spiritual training, such as Reiki, Qigong, or energetic sensitivity. You can go through any kind of training, but it is up to the self to continue with personal discipline and learning to detect and discover the definitions and parameters of these sensations. It takes time and practice to achieve accuracy and acuity, including self-inspection and constraint. More discussion about energetic changes and awareness can be found in the article Energetic Sensitivity. The link for the article is provided in the description below the video. I can share a case about my clinical application of essential oil scents. The patient was a French girl who was an exchange student for college. She came initially for sleeping problems because she felt that she was sleeping very poorly and feeling upset and stressed most of the time. I prescribed herbs and sometimes acupuncture. She said she was feeling a lot better after about 2 weeks. Before she returned to France, she asked if there was a way for her to continue with this improvement after she left Taiwan. We had a little discussion, and because it can be difficult for her to locate Chinese medical doctors in Europe, I asked her if she was okay with using essential oils. I wrote essential oil prescriptions for her for 2 seasons, where she can use them in the shower and use the warmth and water vapor to disperse the scents. People who have received essential oil prescriptions from me would know that the emphasis of these scents is not about making sure you can smell them, because body conditions can affect sensations, and it is enough to know that you have used proper ways to disperse the oils, and the body will still be stimulated and react to the aromatic compounds. The prescriptions I wrote for her were for summer and autumn. The summer one had lemon eucalyptus, 3 drops, sweet orange, 2 drops, wintergreen, 2 drops, and myrtle, 1 drop. The autumn one had sweet orange, 3 drops, myrtle, 2 drops, true lavender, 2 drops, and rosemary, 2 drops. She emailed me later in winter asking if I could write a winter prescription for her. She mentioned that it worked very well and helped her a lot. So it is up to accurate understanding and insight of body energies, atmospheric changes, and seasonal connections that I can detect these interactions and achieve good effects with essential oils and scents. This is all for today, and I will see you next time.